Well, it is 4 o'clock this Wednesday for the Got-IT Talks again. It is my pleasure to welcome another expert in the digital health field. This time, Nicolaj from the DCHE, my good colleague, and also a very experienced, digital developer, digital health developer of various kinds. But allow us, as we do normally in these Got-IT Talks, to know a little bit more about you, Nicolaj. I mean, what's your background and how did you end up working with digital development?
Well, first of all, thank you for having me and for the invitation. For the last 16 years, I've been working in the area of empowerment and long-term diseases in a non-digital setting, and we have been covering all somatic and mental diseases and trying to support people in managing life with disease or after being treated for disease with the consequences of the treatment, and supporting them, giving them tools for managing everyday life and will make life worth living again. And during this process, we've been analyzing our target groups, and we could see that we had several holes in the people that we engaged in these workshops of empowerment, because for several reasons. For example, living with chronic pain, it's very difficult to participate in physical workshops and physical activities because of the pain. But also in the mental area, anxiety and depression are also barriers for participating in physical groups. And the approach we're using is actually, the group is very important, because if we're trying to sort of train managing everyday life, it's a very good setting doing it together with other people instead of doing it yourself, because then you get the inspiration and also the very common human feeling that if you meet someone who's worse off but still trying, then it will motivate you to try yourself. But many, for example, social anxiety, we never got them to participate in any physical meetings. I mentioned chronic pain. But also at a general level, we could see that people had been dealing with the symptoms or the misdrive for more than 10 years before participating in these physical workshops. So we're all the time trying to figure out how to make these workshops more easy accessible. And one of the answers for that is, of course, digital health and digital solutions. So back in 2016, we started developing a program dealing with anxiety and depression on an online platform, and immediately we saw different people. First of all, of course, we managed to recruit people with social anxiety. They had a good feeling about sitting behind the screen at home, participating in a group instead of meeting in a physical room. But we also saw people who still were employed, working, and even though it's sort of a strange dilemma, but in Denmark, all these activities, even though we tried to do them outside working hours, then we started up at 3 o'clock in the afternoon or maybe 4, but everyone who's working know that 3 or 4 o'clock in the afternoon is still working hour. So using digital solutions made it possible for these people to participate, and we had examples of people working and made an agreement with the employer that they could take an hour off, staying in the office, participating in an empowerment group, going back to work afterwards. So So the motivation for using digital health in the first instance was to reach the target group that we didn't reach with physical workshops. So that has been the motivation. Next to that, I would say that, and now we're talking before the pandemic because that sort of changed everything, but I
I
had
know
this
that once
feeling,
upon a time there was a time where there wasn't a pandemic. Yes,
yeah,
it's worth remembering it sometimes.
sometimes, yeah. But at the same time, I had myself this thoughts that well, a lot of the elements in our physical workshops were very cool, but some of the elements actually didn't work that well because sometimes we forget all the obstacles in the physical face-to-face meetings. It's too hot, it's too cold, the light's wrong, the transportation to or from, and all these things that actually made it stressful or not optimal in these physical workshops was as well things that I've been wondering, isn't there a better way to do it?
Mm.
And one of the solutions could be digital health.
Hmm. Well, that of course describes a journal of evolution of various services from the DCHE. But also, I'm curious, of course, Nicolaj. So you're a digital developer by training, or you're a doctor, or what's your professional background in working with this?
Yes, well, I have a master from the University of Copenhagen in philosophy and rhetorics. Um, and well, my major thesis from university was actually about how to prioritize in the healthcare system, how to figure out who should get the treatment first and what kind of treatments which should we prioritize and what kind of treatment should we not deliver. So throughout my education, I've been wondering about how to sort of optimize healthcare systems. And that, of course, is also from a personal background, being a son of a doctor and a nurse, listening to them discussing treatment versus prevention all my life at the dinner table. So yeah, these have definitely sort of framed the perspective that I'm working with even now, 16 years later. So
So,
yeah.
in that case, you might say you were, of course, well trained, or maybe damaged from birth when it comes to thinking about health services. Um, but coming from a field of philosophy, if you either from a field of philosophy or your general experience, what do you then focus on when you use this digital transformation? Is it mostly sort of the optimization of the services themselves, or is it about doing stuff that you would not be able to at all do without them, or is it more like exploring the simply the innovativeness of delivering something else? What's the main focus areas? Not maybe not just your own, but in your team.
Well, a good question. And I would like to start off with a little anecdote from a long time ago. There was this project where they analyzed the doctor-patient situation at the general practitioner, and they found out that a lot of times when the doctor started to explain something, he sort of flipped the paper around and start drawing at the back side of the paper, showing the patient maybe how the lung functions or whatever. And then some clever people produced 20 small, very precise graphic, illustrated, cartoonish movies of maybe 1 or 2 minutes. So if you had sort of a very severe flu or cold or something else, then you could take a small video back home, and then you listen to the doctor, you go home, and if you're a guy like you and I, we would show it to our better half, and they would understand what the doctor told them as well. And this was a very simple solution, but actually quite cool. And later on, I've been involved in audio recording at hospitals, simply recording the doctor-patient conversation, so you can take the recording back home and re-listen to it. Again, very simple solutions, but quite effective. So to get back to your question, what is my aim with digital health? Well, it's actually to find out where it works best. And as I mentioned before, the physical room is not optimal, but for some things it's optimal. And one of the really important thing is the physical face-to-face meeting between people. And now we're talking through the screen and we have a two-dimensional picture of each other. We will miss a lot of things in our communication and in the perception of you and I looking at each other through the screen. So for sure, the physical meeting is very important, and you cannot sort of, well, in my perspective, it's very difficult to create something better in digital health. But some things are actually better in digital health, and I just gave two examples: the audio recordings and the small cartoon movies, but other things as well. Because my experience from before the workshop was that even though I recruited a group and I asked them to meet me at a certain point in time, then I would ask them to prepare something. Maybe just read a small leaflet or something like that. And I could be sure that less than 50% have done that. So actually communicating through letters or mails, asking people to prepare is a method that is not working that well. And now, after really been exploring the digital era, I find that you can actually, with the notion of easy access, create platforms where you motivate people to attend, because it's easy. It's when you want it. It's on your when you're ready for it, and you can re-listen or review something. And so I actually see in digital health that people are more prepared. They're more ready, and they have, if you're clever enough in your preparation, they have actually thought about some things before attending. So that's one point where I really see that the digital era has provided us with something. And just to give another analogy, at the Danish universities now, a lot of the old classic auditorium speeches from lectures, now they're videotaped, and the students get the video and they can re-listen, and they're not obliged to attend, because everybody know that in these auditoriums it's not meant that you should comment. It's not meant it's one-way communication. And why don't we record it? And as with the audio recordings at the hospital, you can re-listen, you can prepare. So this is one area where I see a lot of potentials in digital health, that if we are clever enough in the way we produce it, so it's easy accessible, and it's something that actually motivate people to stay on the platform, then when you meet in person, you can start off from another starting point than in the old days, face to face. Yeah.
Well, I'm reminded by the fact that I used to do a lot of very good napping while I was in those auditoriums as a younger man. So it's not that it doesn't have any benefit, but it probably wasn't the benefit that they were looking for. But so a point of exploration about things that's not possible normally. Is it also an element? I mean, the traditional paternalistic view of the healthcare system would be one where you lined everything up to fit with the healthcare professionals. The good old, the doctor will see you now. It's just an element where people feel that they've that they're part of this system, as opposed to just being a nuisance, maybe. Not necessarily a case where it's the patient will see you now, but at least just a meeting halfway.
Yeah, good question, because that's one of the that's one of the things that you need to be aware of, that using the digital platforms just to deliver information and knowledge is not the answer.
Mm.
But regarding my focus around empowerment, um, which is tied to the old discussion around compliance as well, the way that that I see, well, let me start over. Um, if you want people to participate, patients, then we know that the old paternalistic way wasn't the way. Maybe, in the old days where it was more simple, but now it's much more complex to be a patient in the system, and we are much better at treating people so you don't die or get really incapacitated. You actually are able to live your life afterwards. But the problem is that if you have the old paternalistic relation between doctor and patient, then you sort of get to another problem that we're not together with the doctor every time, all the time. So my perspective around empowerment is actually more to figure out how to engage people, how to make them sort of make the setting. And the
Mhm.
funny thing about the audio recording was actually that it sort of changed the whole relation. So now it was the patient in charge. If you think a little about it, usually patients, they're sick. That means you don't have the same amount of energy as a doctor. You don't have the perspective of the doctor, and you probably also have symptoms that sort of creates barriers for you in participating at an equal level in the conversation. But using audio recordings so you can re-listen and you can go back and make follow-up questions. We did some, well, we didn't, but there's been done some pretty cool research around the follow-up questions and the quality of the follow-up questions if you audio record the conversation. And one of the funniest small findings in these studies is that sometimes the patient didn't even re-listen, but just having the knowledge that they could re-listen made
Mhm.
them create better follow-up questions. So
So,
yeah.
I guess this, from your experience, always also leads to a lot of these doctors being very positive about the audio recordings.
Well, that was one of the funny things because, of course, in the start there was a lot of criticism from the professionals. And the funny thing about the audio recording was that at these hospitals there was a lot of skepticism from the professionals because they were afraid that they would have a big rise of complaints from patients because now they had the audio recordings to prove what the doctor said to them. So part of the whole perspective of this audio recording testing was to figure out how to approach this skepticism. And the cool thing they did was they showed the doctors that they got better follow-up questions. So in this way, they actually motivated the doctors and other professionals to participate and actually encourage patients to use these audio recordings methods in the conversation because they found out that it was better for the treatment. So, and this sounds very easy. It was a long process, and they had one of the other things they did was that they provided communication training for all professionals at the hospital as well. So they had training in how to communicate, which is a funny thing as well because um,
Imagine,
yeah,
yeah.
yeah. So these are actually the two main ways
Mm.
to sort of manage the skepticism. One thing was to show that it increased the quality of the treatment, and the other one was to provide communication training for professionals. And actually now they're doing
And
it as a normal thing. They have big posters everywhere in the hospital saying, "Remember your device to record the conversation."
so suddenly, moving from skepticism into pride, sort of, almost, which is fascinating. Would you say then that these cases, that they're also sort of an element of a shift in mindset that's related to the pandemic, or are these things that have been happening over time, and it would have happened even without the pandemic.
Well, these audio recordings happened before the pandemic, but one thing that for all of us, and I guess you and I experienced as well, that before the pandemic we didn't use Skype or Teams or Zoom or GoToMeeting as much as we do now.
No. Yeah.
We did use it, but for a lot of things we figured it was the second best.
Mm.
Now, yeah, well, it's not the best for everything. I mean, the physical meeting is still also something that is very important. But from my own perspective, I would say that there's a lot of the physical meetings that I prefer to take digital now, because we sort of frame the focus, we share a document, we work in the same document. It's actually difficult to be in the same room working in the same document.
Mm.
While doing it on GoToMeeting, it's quite effective. But so for sure, the pandemic have shown us and forced us into using these digital software products to be able to meet, even though we are supposed to be at home. But going back to my prior analysis of our target groups, this was the situation for the chronic pain patients and the social anxiety people before the pandemic. The big change was that all of us sort of embraced these new methods for communicating, and made it much easier also to recruit people. I mean, now in Denmark we are sort of, I hope, on the other side post pandemic, and now we have a lot of problems recruiting people for digital empowerment workshops. Now people want to meet in person. It makes perfectly good sense, but then we will stop recruiting the people that we recruited throughout the pandemic. And I have some quite interesting numbers to show, because, for example, chronic pain, at our physical workshop, people attended, in general, they had an average more than 10 years with chronic pain before attending a physical face-to-face workshop. In the digital workshops, they have in average lived with chronic pain for 6 years. The same numbers applied for significant others or caregivers. We have a big program for caregivers in Denmark regarding all kinds of diseases. And when we met them at the physical workshops, they were sort of standing at the edge, looking at depression, anxiety, and all stress and stuff like that. And having, I think it's 11 years in average, been a significant caregiver for someone else. For the physical workshops, and again we are 5.5, 6 years in average for the people attending the digital workshops. And
So it really lowers the barrier.
sorry.
It really lowers the barrier to start these courses, or some maybe
Yeah, for me
the
it's actually about
yeah,
easy access. I mean,
easy access.
the whole concept about making things very easy to access, and maybe also stigma.
Mm.
Around the significant others, caregivers, there's a lot of stigma. And the
Mm.
stigma is around, how can I complain about my situation when I have a significant other that's really sick?
Mm.
So I just
So,
need to
so
do my,
when you say that people now post-pandemic, or sort of post-pandemic, are moving back into the physical meetings instead, who are they? Who are, I mean, the people with pain, are they, would they prefer the physical meetings, or who's actually sort of um, pushing that agenda? Is that the patients?
hmm, well, yeah, good question. I think, first of all, I would call them people because they're in their everyday life. So I would
Mm.
say uh, it's, well, maybe I think there's several answers to this, but the main thing is that still we have this concept of, if I attend a workshop, I would prefer to attend a physical workshop. So regarding our chronic pain program, we sort of go back to getting the old people we got before the pandemic. But
Mm.
I mean, we know that regarding chronic pain, we have people who cannot even stand having clothes on their body because it's too
Mm.
painful. which makes it impossible to attend a physical workshop. So I sort of think that at the moment in my area of work, I see a shift going back to the before pandemic situation where we got a lot of people to attend our workshops, but we maybe didn't get the one who really needed it because they were not ready for it at the time, or they could not attend for physical reasons. And I see that we got a question about easy access, so maybe I should
We
just
did,
elaborate
yeah.
a little bit around easy access. I mean, at the moment in my family, how to deal with making dinner every night. Easy access is companies coming with a box for us with a very easy ingredients list, and you just go from 1 to 6, and then you have a good dinner and it's healthy stuff. As an analogy to empowerment workshops, well, it's not easy to attend a physical workshop. I mean, if you're a chronic pain patient, if you're a significant other, if you are a cancer patient with post treatment symptoms and stuff like that, it's quite stressful. It's quite hard to attend to physical workshops. So that would not be something I would call an easy access solution. For them, an easy access solution is maybe more turning on your computer.
Mm.
And
But
I know that we are missing. Sorry.
yeah, would that then mean that that you should stop actually offering physical meetings?
No,
If you know that that you will reach a higher proportion or maybe a diversity or a group of people that would have a higher need, and indeed also if even if you offered both, that people by tradition, culture, would choose or think they wanted the physical meeting, but then give up or not really be able to. So, is this a choice that you should make for them?
no. I'll try to give you the complex answer for that question because there's a lot of perspectives to this. But as I said before, I see that the digital solutions have, in some areas of training empowerment, they're in front of the physical meeting. So the
Mm,
whole, and we're not talking about a lot of information that we have to give patients, but to make them prepare and think about the situation in the perspective of some knowledge that we give them. I think that it's better to give that through a digital device where you can do it in your own pace and you can do it in your own time and when you're ready, when you're fresh, instead of doing when I've defined we need to meet. So
mm,
to the question about should we stop doing physical workshops? No, we should not stop doing physical workshops, but maybe we should start thinking, what should we do when we meet instead
mm,
of doing the whole thing in a physical setting?
mm,
One of the things that we experienced through the pandemic regarding our anxiety and depression workshops was that actually making sort of a mixed blended learning solution digital through the pandemic, but now we could maybe see a blended learning digital physical meeting thing, or even something, a third solution would maybe be the right thing to do. And the reason I call this a complex answer is that my experience is that people are ready for the physical meeting at different times. So when
mm,
we looked at our data that people attended after 11 years of being significant others at our physical workshops, that was when they were pressed out, standing at the edge of being really ill themselves that they attended. And
mm,
another way to answer this question, do we really need to be so stressful before we attend physical workshops?
mm,
Maybe we could see a future solution where we reach people earlier, give them tools, give them perspectives, give them support, so they never reach to that point after 11 years of being really stressed out and almost sick themselves. So my perspective is for the future that we have to deliver workshops and services in a lot of different ways. Because one of the experience we've had around the significant others and digital workshop we've done is that that is not necessarily the cool solution for them either. Because if
Mm.
you're a significant other and you're at home with your sick significant other, then you don't have this sacred room with other caregivers where you can actually talk about how tough it is to be a caregiver. Because if you do that at home and your sick significant other is listening to the whole conversation, then a lot of people experience new problems. So the whole making everything digital is not the solution either. During our experience working with digital platforms, we've all the time said we want the group to meet, whether it's through Zoom or whether it's through another device, it doesn't really matter, but we still need that human meeting. But actually
Mm.
now we're testing some e-learning solutions where you don't have a group, where you're only there yourself. And the reason we're doing that is not because we don't believe in the group or the physical meeting anymore, but we believe that we should tailor our services so they fit the need of our target groups. So now we have a solution for caregivers that can only attend a workshop at 4 o'clock in the morning because that's when they have time or
Mm.
whatever. So and yeah, and then you have the whole phase of accepting your situation. People don't attend workshops giving support in empowering yourself before accepting that you're in a situation where you could need help. So
Mm.
again, if we could tailor services to reach people earlier, and that's what I mean by easy access, making them intrigued in participating in something digital earlier in their own journey of being ill or a significant other, then maybe it's a good thing.
So
Then,
not
then,
necessarily about discovering the way of doing stuff, but being the master of many.
yeah, and well, you and I and others have sort of created this model of the 40-20-40 solution. And just to give a very quick intro to that, my idea of this model is that you need to think about what happens before we meet, and you need to think about what happens afterwards. That creates the best framing of the physical meeting when we actually meet. So if you could do something that motivates people to think about the issue, the problem, the target, the content of a workshop, and then attending together at some point. But at that, in the physical meeting where you're attending, that's 20%. Then we should be really focused about what is the next step. What will you use these 20% for? And the answer to that is something behind afterwards, which is the
Mm.
next 40%. So beginning to think, and this model sort of embraces both face-to-face meeting, digital meeting, e-learning, blended online learning, all these different ways of motivating people. And the interesting thing is that in the business world, they've been using e-learning for many years. My wife works at a bank. Every month she's obliged to do the e-learning, so they're sure that she's up to date on GDPR, she's up to date on whatever, and that's sort of, so she's sort of forced into e-learning, and that's maybe the easy way to do e-learning. We need to do e-learning in a way that is interesting, motivating, intriguing for you to participate, because you can all the time turn off the computer and do something else. So this is the big challenge for us, especially right now when everybody is fed up with digital services and want to meet in person. I understand that. I have the same feeling. But if we succeed in this, then we can actually support people in a different way. And just to give a small example regarding social anxiety, which is something that is not only tied to a mental disease, it's actually also a consequence of a lot of physical diseases. I mean, slowly but surely losing your ability to participate in groups and be in a social being and stuff like that. imagine if you could actually give people small ways of training themselves to get back into the social arena, back home behind the screen, and in that way motivate people to start getting out in the real life again, then
Mm,
I think we have a good solution. And it was never a good solution to do physical workshops. And I know some people will say, yeah, but actually the physical meeting and the physical workshop is part of the process of dealing with social anxiety. And I
mm,
agree. But I
mm.
also meet a lot of people that have such a high level of social anxiety that it's bullshit in the areas. Sorry, my French. Because for them, it's not a question about training to get back into life. It's not a possibility anymore. They're sitting back home, and now we've developed a lot of other digital services that makes it much easier just to stay at home. You can get all your groceries at home. You can, yeah. Um, so, so that's for me a good example of using digital platforms to get people in the process of getting back into the physical meeting. Um, so
Instead of keeping them from it. I guess
exactly.
though that the experience in the pandemic of having these two very very different ways of doing stuff have always then shown some of the positive sides of one of them and some positive sides of the other. Is that then some of the key learnings that you found from the pandemic, or what would you describe as either from a is the
Well,
key learning here is about adapting to the user, or would you describe a number of other key learnings that you've had from the pandemic specifically?
my main focus have all the time been to ask myself, how do we engage the user in a maximum way? How do we engage them as much as possible? And that's not only regarding empowerment, but also regarding treatment, regarding whatever. How do we engage people? And um, looking at the situation right now, when I'm thinking about a new solution, service, workshop, whatever, now I have 20 more questions to ask myself about the arena before trying to develop it, because now I need to figure out what room are we in, what space are we in what setting, and how do we connect the dots, how do we connect the everyday life, the physical meeting, with the other cool solutions. And I mean, one of just to go back to our anxiety and depression workshop, what we did on the online blended learning was that we, sorry, some of the questions that we asked in the physical workshop when people met us, now we ask them through the digital device. So instead of being in a room with 16 others where you know only maybe 5 people participate, comment, ask questions, and discuss in the group, the rest of them are just listening. Now we do the first part of the discussion back home, where you have your own time, you have your space, you answer questions in the way you like. I collect the questions and I frame the physical meeting from the starting point of the inputs I get from the participants. I mean, this is a much cooler way of delivering services, that instead of me figuring out what these 16 people would like when they attend. So that's
Mm,
one thing. The other thing is the whole health literacy question, that as I said, in physical groups, usually it's maybe 1/3 that participate. So they take the power in the discussion. They sort of make the perspectives, give the answers, and the rest of us are just listening. Now, another example of easy access. Now we sort of equal out the opportunity to participate and frame the dialogue by asking people to do the first part of the reflection back home, when and we can see that we get a much bigger variety of perspectives. And at the same time, when we start meeting in online or physical face to face, then instead of it's me who are framing what we're talking about, it's actually the participants. And
mm,
the cool thing about this is that that and we know that from other communications arenas, that this makes a much more progressive way of communicating than the old paternalistic way where the doctor just told you what to do. Because
Mm.
when we're looking at these target groups that I'm working with long-term somatic or mental disease, it's much more complex than a doctor can explain you. And even though when you ask people what do you need, they would say more knowledge. Uh, but when we have had the pleasure of inviting people into workshops and ask them what was the greatest benefit, all of them are saying to meet other in the same situation and reflect about some things together, because
Mm.
humans are social animals. So we need this reflection together, and we need to sort of mirror ourselves in front of others to so you can actually do that.
Mm.
And yeah, so in certain ways I see that we sort of pushed um, uh, the outcomes of the physical meetings by attaching a digital pre or prologue or whatever you say
Mm.
to the physical meeting, where people are in their own setting and delivering. And let's face it, I mean, if you ask people around you throughout you said yourself, sometimes you slept through the lectures in the university. Me
That's
too.
the part of the interview I'll edit out, Nicolaj. But
I know, but
of course,
but
yeah.
this is just another example of some of the negative things about the physical meeting, that not of all of us got the same benefit. And I see a tendency that people on a general level, our groups, more people get the same positive outcome because we sort of engage them earlier uh,
Mm.
through digital devices.
So on one hand, what I'm hearing is that you're saying that that there's both been an experience of an increase in quality of effect, and also that that there still is a potential for an increase in that. If you blend the tools right, you have the potential for a higher quality of services. You also mentioned that it makes, if you will, your life harder in considering a lot of more options. So, as a digital health provider, digital health developer, what would then be some of the key advice to some of your colleagues on how to tackle those extra issues? Have you discussed that with yourself, looking in the mirror in the morning, or maybe with your team members? What are the principles of how to tackle that challenge?
Well, the main answer to that question is actually again user involvement. That we need to involve the users from day one, um, and I mean all the cool things that I see or hear read about have a big focus on how to involve the users, how to make them part of the development, how to and even how to create the right way of measuring the effect of these things. Because uh, before uh, I also sort of framed what will be the perfect outcome. And
Mm,
I mean, I've never tried living with chronic pain, so how could I figure that out? It's
mm,
impossible. But
mm,
involving people, then suddenly you get some quite cool knowledge about what's in it for them. Why are they attending? Why are they? And we're talking about people who are desperate. So why do they, even though that it's painful sitting in a chair in a physical meeting for 2.5 hours, whatever, why do they do it? That's because they're desperate. They don't they don't have the right tools for it yourself. And so figuring out how to blend the 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 ways we are meeting people. I can give you another
mm,
example. At the National Hospital in Copenhagen, Rigshospitalet, they have a department who are for breast cancer patients. And there's been done a lot of research, and we have a lot of young couples just in the phase of life where you give birth to kids and get the whole family thing going. And then suddenly the mother, the wife, gets very ill and get through a very long, complicated, and hard and stressful treatment period. And we could see a lot of divorces. We could see a lot of misdrive for kids. We could see a lot of misdrive for the husband and stuff like that. And at the moment, we are actually trying to create a service that is really closely tied to treatment, because we know that, well, there's several, not to get into a long story about this, but we know that there's several points in the treatment where things get really, really difficult. So what we've done is that we created this small mobile first service, so it's on your mobile phone, a service that actually at the point where we know that it's very important that the couple, the man and the wife, are actually talking together about these trouble, we sort of support them in taking these conversations. And we closely tie this to the treatment. So now we have a blended solution where you have the initial treatment, but we knew beforehand that people got out of this treatment, and if they survived, they had a pretty miserable life afterwards. They had the whole fear of a reoccurrence of cancer, but they also had the whole female identity with losing breasts or not aware, being able to breastfeed your kid after treatment or whatever. All these things now we have sort of framed in a digital mobile first solution that follow your treatment. So it's the nurse that you meet at the hospital that is in charge of your treatment that as well give you this service and says, this is quite important for you, because if you want to come out on the other side being a whole person, you need to have these conversations. You need to take these things into consideration. And now we are trying to do that through a digital device that the couple use themselves, and not there's no data going back to the doctor or nurses. That's not the point. The point is that our service hit the couple when they need it. And that's another thing that was impossible before, because we needed to, I mean, if you do physical workshops, you need at least 10 people to start off, otherwise you don't have a group. So one couple who were ready and in need, they had to wait for 9 other couples or whatever. Now we have closely tied this service to the treatment, and they get it when they need it. And you could ask, but Nicolaj, how is this user involvement? Well, all the research done was actually done by patients, by the involvement of patients. What is important for me? And then we tried to figure out when do this occur in the process, and how can we support it? And I mean, a lot of these discussions, they were not relevant 20 years ago, because 20 years ago the treatment in Denmark for breast cancer was terrible. So they never got to the point. But now we're getting very good treatment. People survive. They actually have a possible good life to live afterward. But the side effect of the treatment and the period of the treatment is so hard on you, physical and mentally. So a lot of people get really live bad lives afterwards. So now we're in need of creating something different, and the idea of attaching these empowerment services to treatment or to the after treatment or whatever. So it's when you need it instead of when we are ready to give it. Because another thing about face-to-face workshops, especially in the Danish municipalities, is that, well, they do workshops in February to June and from August to November. So if you get a depression in June, you have to wait 5 months, so to speak, 4 months maybe. And now in Denmark, with our online services, when a person comes to the local health center and say that I need help, then we can actually apply and then give them a digital group service where they meet other people and have some of these discussions now when you need it. And then to get back to what is the future, I hope that the future is that these digital services can stand alone, but they can also be part of something where you meet up physical later when you're ready for that. And so there's a lot of combinations in these things that we need to explore now to figure out how do we get the best mixture of face-to-face meetings and digital supported services to make sure that we actually help people when they need our help. I get
But
a lot of our we of course do questionnaires for all participants in our workshops, and we get a lot of comments saying, "Wow, if I've met this offer 5 years ago, it would have helped me so much more than it did now, because now I was so out of it. So it was like the last thing I sort of thought of doing." And
mm,
and I support them, and I acknowledge that that's a feeling that is really relevant. But at the same time, I'm thinking maybe you are not ready at that time for the physical meeting. And our data now shows that a lot of people are ready to do something on the computer by themselves, not being in a group, but just figuring out, what do other people think? How could that support me? So they're motivated for that. Yeah.
but speaking of the how, what would you then describe as some of the key barriers? We need to figure out how to do it. But what do you think maybe are some of the barriers stopping us from figuring that out? Simply that we need more time, need more resources, need political will, need more. I mean, I'm not
Yeah.
trying to nudge you in a
Yeah.
particular direction, but
Tough question. I mean, the simple answer is, of course, that we need to make sure that everybody has good internet and have
Mhm,
nice devices and are able to use them. So the digital literacy question is, of course, relevant.
mm,
Um, Next to that, many years ago, I read this article about multifaceted solution, that we need all the time to have many pathways into solutions, and so that's also part of the answer. Um, Resources, yes, it's nice to have a lot of resources, but the I don't see the best solutions coming out of a lot of resources necessarily. They're nice to have, of course, but mainly, I mean, user involvement is not that expensive. It's quite simple actually. Um, but of course, you need to have the guts to ask people what they need. Um, if you continue to have your idea of what they need and you just involve them for because I say so, then we get nowhere. But actually looking into the future with a lot more user involvement is a quite intriguing feature. We've seen it at some point in the in the mental treatment in Denmark, treatment for mental diseases, where we have recovery mentors, we have people with user background actually becoming doctors and nurses and other professionals because got so frustrated with the system themselves, so that motivated them to take the education. Another funny thing is that in Denmark, if you see a GP getting a very severe illness, if they survive, they always write a big book about how to change the system afterward, because now they try to be a patient. And I mean, um, looking into a future where patients are much more involved in how to create services and also treatments, because one of the problems with all these people that 20 years ago the treatment killed them, so to speak, I'm sorry to say, and now you survive, but you survive with severe side effects. Um, it would be quite interesting to discuss the bonus and the negative things of treatment with the patients, asking them what is important for them, instead of now where we sort of make treatments and we do a lot of research to figure out whether it's cool or not. But I mean, I've met a lot of let's say cancer patients or heart patients and stuff like that, who are quite sad about their life afterwards because they lost the things that were most important for them. And that would
Mm.
have been cool to ask them, do you like this treatment, when
Mm.
we know that this.
Well,
So
it is, of course, inherently a bit tricky if you'll allow my cynical comment to ask the ones who died what they would have preferred. So
it's a
you
good
have to make
question.
do. Yeah.
And
Um,
that makes it also very complex to do user involvement. Is
mm,
I said before that it's easy to ask people, but one of the tough thing is that you actually need to take into account the answers, because
mm,
the answer is also that I would live no matter what, and then we
mm,
need to discuss that. But taking the discussion into account when we develop new treatments and new services is, in my perspective, a positive thing.
mm,
And maybe even something that will also make the communication around the treatment more precise, because I know doctors that are afraid to take that conversation, because what will the response from the patient be,
mm,
and yeah, so it's not easy, but
mm.
we
No,
yeah.
it's not easy. It's not easy, as you say. But yet, would you say now that again, it's very different from country to country in Europe, but at one point, one might be able to say that the pandemic is gone. Would you say that you remain hopeful that we've actually learned either from the pandemic or from our recent digital discoveries on how to do that leap of quality, or are you doubtful on whether we've actually learned anything? Um,
I think we
Using
learned.
your example of people going back into the physical meetings, although they might not actually be the best quality.
Well, first of all, after those 18 months of lockdown and everything, all of us was motivated to meet people. And I don't know about you, but the first big gatherings I was in, I felt insecure, but at the same time, I felt happy. So, so one very positive thing about the pandemic was actually to remind ourselves that it's quite important for us to be together with other people. So that's just on a general level.
I agree.
But
I agree.
and
Yeah.
and going back to my main target group, people with long-term diseases and in the mental and physical area, we need to remember, for them, they had a hard time participating in the everyday life with the rest of us before the pandemic. And
Mm,
um, if we could see a future where we use the digital techniques to meet when that's the way to do it, then we're in a better place. And the cool thing is that I see no way that we would close down physical activity at all, just sitting at home, because all of us felt the need to meet people. But the cool thing is actually, if we in the future, um, a, a very small example is my cousin have lived in the States for the last 30 years or so. I've never been so much in contact with her as we've been through the corona, because suddenly we started Skyping, and
mm,
we emailed before, and we once in a while we had a telephone conversation, but now suddenly we arranged meetings and had a glass of wine. She lives in California, so it's an early glass of wine for her, but still, so our relation got stronger through the digital means. So
mm.
it's not one or the other, but looking at how to figure out how to juggle between the best ways of communication is.
Between the two and
Yeah.
striking the right balance.
Yeah,
Um,
and then
yeah.
of course you have all those also. movies where you look into sci-fi movies about the future where we never meet, but just avatars living in brains in a what or whatever.
Mm,
I don't see anyone going that direction. I mean, the pandemic showed us that this is not the solution, but
mm.
but maybe there's a common third that's quite interesting to explore, and that's regarding services, empowerment activities, and empowerment support, but also everyday human interactivity. Uh, that there's also quality in that. Yeah,
Indeed, human interaction. There's definitely quality in that. Thank you very much, Nicolai. It's been a pleasure to talk to you today. Um, it is always a pleasure to meet, even digitally.
yeah.
And thank you very much for joining the Got It Talk today. Thank you.